I want to make sure we get going on time here and respect your schedules. And I know a lot of you are probably in the middle of your workday at some point, and so yeah, I appreciate you taking the time out to meet with us. And we're just going to tell you a little bit about who we are and hopefully how we can be a help to you and your TOR program at your place of work. So first I'll introduce myself. I'm Kate Trams, and I am a communications coordinator with the Addiction Technology Transfer Center. And I want to introduce quickly a couple of people who we have on right now. We've got Kathy Tomlin, who is one of our consultants, and she is a longtime friend and consultant for our addiction and behavioral health programs. She is one of the most prominent motivational interviewing teachers and directors of a program, and she is a wonderful resource for teaching other Native people how to use motivational interviewing in a way that is culturally appropriate. And so Kathy, did you want to say hello or introduce yourself at all?
Hi, hello everybody. I'm really just very interested in listening today and hearing what people have to say, and you just made me blush, so that's a big introduction. But thanks and look forward to hearing from people listening. That's my goal today.
Yeah, thank you. And then we also have Pam Baston and Shirley Kane on from JBS International, and I'll ask you to introduce yourselves here, and then they're also going to be sharing a bit more in just a minute as well. But Pam, would you mind introducing yourself?
Sure. Hi, everybody. I'm Pam Baston. I've been in the field 40 years and worked in technical assistance in Indian country for the past 20. And it's a pleasure to be here. And I'll also, as I pass it on to Shirley, then Shirley can pass the baton to Jessa Jackson, who's also from JBS on the line. So Shirley?
Well, good afternoon, everybody, or morning, wherever you're from. My name is Shirley Kane. Washkasi Koi Indigenous Misquagamiwi Zaga Ganingen Dunjaba. I'm from the Red Lake Nation, and my clan is Eagle, and I'm with JBS International, and I'm been with them almost a year. It'll be a year in about a month or so. So it's like it just flew by, and my background is in law, but I've also done work with the state in dealing with grants and child welfare and behavioral health, and it's really good to be here today.
Jessa?
Excuse me, next is Jessa, sorry.
It's okay. You have to unmute yourself, Jessa.
Hi, my name is Jessamine Jackson. I'm the digital media research assistant on the TOR team at JBS International. I've been working here for, I guess, almost 5 months now, and so far, so good. I've enjoyed making the graphics that you will see today in the PowerPoint presentation.
Excellent, thank you. All right, back to you, Kate.
Wonderful. Great, thank you. And I know my director, Angelina Skinstad, is going to be joining us here as well. And some of you probably know Jeff LaDolter. He is on leave this week, and so I am filling in for him. That's probably why it might be a little bit confusing to see me, but I'm kind of trying to take his place right now. And so we're going to get started, and I am going to share some information on our program at the ATTC. Oops, I'm sharing the wrong one here. Let me pull up the PowerPoint one. Okay. Here we go. So as I said, I am with the National American Indian and Alaska Native ATTC, and we actually have a few different grants through SAMHSA, and we wanted to share a little bit about all of those with you so that you all as TOR grantees know what you have available to you, the expertise and the curricula that we have, in case any of this is something that you might need technical assistance or training in. And so we're just going to go over a bit of that here. So our umbrella organization is called the Native Center for Behavioral Health, and this includes our addiction, mental health, and prevention technology transfer centers. And we are housed in the University of Iowa College of Public Health, Department of Community and Behavioral Health. And here's kind of a graphic of our organization. You can see Annalena Skinstad and Sean Bear are our director and co-directors. And then we have some staff who work across all programs up there at the top. And then we have our ATTC, and the TOR grant is under the ATTC. And then we have MHTTC and the MHTTC K-12 supplement and the PTTC. And then we also have some staff within the college who help with administrative things as well. And here's some pictures of our staff. So if you're ever wondering and you want to get in touch with us, you can get an idea what people look like. You can refer to this later if you want to. We'll be sharing these slides as well. We also wanted to share, you can see our advisory council members. We want to make sure that this is, these are people that we work with very closely because we want to make sure that we are representing the opinions and the viewpoints of tribes across the country. And so we have invited members of the field who are coming from tribes across the country to be a part of this advisory council. And then we have ex officio members and consultants listed here as well. And then we also have collaborators that we work with quite often. We work with the Alaska Tribal Health Consortium in Anchorage, and the Comprehensive Drug Research Center at the University of Miami, who helps us with our evaluations, and Solutions of Substance and JBS International. Pam Baston is one of the founding members of Solutions of Substance, and as she mentioned, she also works with JBS International, and they'll be talking a little bit more about their work in just a few minutes. We do have a Leadership Academy program that we offer through all three of our grant programs, and it's a collaborative project because we want to be able to offer workforce development and leadership training to behavioral health professionals in addiction, mental health, and prevention programs. And so this is an annual program where we usually have between 10 and 15 mentees or participants. And then we also have mentors who have been working in the field much longer, and they're paired up, and they are they're both given trainings throughout the year, as well as given opportunities to collaborate with each other and work on a project. And then at the end of the year, they will present on that project, and we have a graduation ceremony. And this is just some of the information about how we have revised the Leadership Academy. Some of this based on the fact that now we are in quarantine, and we used to do a week-long training to start it off, and then a 3-day training in the middle of the year, and that was all in person, and now we're of course changing that to be in a virtual format. This is just a little bit more information on our current cohort of our Leadership Academy that is all running online at this point. And as I mentioned, we work with the University of Miami for evaluation, and they have done some evaluation of the Leadership Academy that ran over the last year. And there was a high level of satisfaction with the program. The leadership skills and knowledge were reported. They reported gaining leadership skills and knowledge during the trainings that we offer, and a high level of support in a positive environment. And so that's always, yeah, that's very important to us to be able to offer that and to really grow the Native behavioral health providers that are new or still fairly fresh in coming into the field, and so that they can be successful. I'm just gonna keep going here so we can, I don't want to take up too much time, but we also are working on a tribal college and university initiative. We want to offer more programs in behavioral health in the tribal colleges and universities. We want to encourage education in behavioral health in those colleges. Sometimes there's not a large public health or behavioral health program. And so given that we have a good amount of curricula in those subject areas, we want to partner with colleges to offer education in those areas. And that is something that we are currently in outreach and in the meeting phase and trying to make connections on. And as I mentioned, we have over 40 educational modules being developed in prevention, mental health, and addiction. And so we want to encourage those to be offered in college campuses. And this is our addiction ATTC, or our Addiction Technology Transfer Center. This is a map of the regions that are covered. And of course, as the National American Indian and Alaska Native ATTC, we serve the whole country and focus on the Native American and Alaska Native populations. Here's some projects and programs that we offer. We have a alcohol and drug prep course. We offer a monthly webinar series on behavioral health. That's usually current topics, things that are coming up more prominently, and especially things that are affecting tribal populations. And then we also have an essential substance abuse skills series, and this is offered every year. And that series is intended to help people who are seeking licensure for substance abuse counseling to prepare for those exams. We also offer training in medication-assisted treatment, historical trauma, and trauma-informed care. We publish a newsletter 3 times a year. And we also offer technical assistance in implementing SUD assessment and treatment, and the importance of spirituality in substance abuse treatment. And this will come up in our mental health programs, but also a big topic for us is incorporating spirituality into mental health diagnoses. And that's something that we offered a virtual series on in the spring and summer this year. You can see, I don't want to take up too much time. We'll try to get through some of this kind of quickly. But yeah, this orientation today is, some of you may be new. You may have just joined in the last cohort that started October 1st of 2020. Some of you may have been working on a tribal opioid response grant since 2019 or 18. Oops, I'm sorry. And we want to let you know we're here to support that with our staff. Jeff Ledolzer is the manager of our TOR program, and then of course we work with JBS staff as well. And so far we have developed a resource center for TOR grantees on our ATTC webpage, and I'll put that link into the chat in just a minute. And there are a number of resources that we have developed that are available on that page that we hope you will find helpful in your work. We also provide TA support. There are, a wide variety of topics that come up when you're offering a tribal opioid response program, and we are here to support that. We are, as you can see in our advisory council members list, we have a lot of people who have been working in the field for many years who are committed to helping those of you who are trying to get a program going, or maybe you've had a program going, but you have some difficulties or roadblocks that might be happening, and we'd love to help by offering technical assistance in those areas and connecting you with people who have been there and who know how to address some of those issues. And during COVID-19, we have adjusted some of our programming. Right now, we have weekly Care and Share listening sessions on Wednesdays. We do have one tomorrow, and then we're taking a break over the holidays. And I believe we're planning tentatively right now to return to doing that bi-weekly, starting up again in January. We are also offering virtual regional meetings, and these are usually day-long virtual meetings that you can join as much as you can on those days, and it's a really wonderful opportunity to get to know other TOR grantees and see what they're doing, to share resources, and to talk about any difficulties that you might be having with your project. We also are currently offering monthly webinars, so watch for those announcements as well. I'm going to go into our mental health TTC, and again, there's our map of the different regions. And projects that we have in our mental health program are the Veterans Curriculum, Healing the Returning Warrior. We also have a LGBTQ Two-Spirit Curriculum, Honoring Our Relations, Increasing Knowledge of LGBTQ and Two-Spirit Wellness. We have virtual learning communities. We also offer a cultural sensitivity curriculum, and that is something that we're currently working on. We have offered this in the state of South Dakota, but we're also trying to work with additional tribal communities to adapt that to their local culture and tribal traditions. We have a suicide prevention task force. We've also been involved in the Sioux City Street Project, which is working to end homelessness among Native Americans in Sioux City. And we have early and high-risk psychosis webinar series. And again, for the mental health projects, we also have a newsletter that we publish 3 times a year. And this is also connected with the Leadership Academy. Going to go on to our COVID-19 offerings through our mental health programs, and we offer the Strategies of Support for Mental Health Providers open forum. This had been weekly. It's actually now been bi-weekly, and I think as of January it may be going to once a month, but that's offered on Tuesdays at 2 o'clock currently. We also have a virtual training in project enhancement and implementation that we've offered twice since we've been in quarantine. And that's something that we can also offer again on request. The Spirit of Communication in Native American Communities using motivational interviewing. And this is also another training that we have offered virtually since COVID-19 began. We recently offered a 3-part webinar series on addressing suicide, and those are all recorded, and we share those on our YouTube channel. And so if you're interested in reviewing those, you can see those there. In our most recent newsletter, we actually had one more recent than this one that was actually dealing with mental health in quarantine and in times of crisis. And so I'll put the link to that in our chat here in just a moment too. And I already mentioned the spirituality program that we offered earlier this year. We also have a skills-based video conferencing series, and this offers an interactive experience that helps professionals learn how to use video conferencing in their practice and what special skills they might need to learn how to adapt their programming to make it work in a video conferencing setting. And we're getting to our K-12 program. Just want to mention a few things here. We have this program is actually, even though it's a K-12 program, we are committed to serving students, parents, school counselors, teachers, principals, educational directors, and tribal boards of directors, because all of those people are involved in the schools and can help make schools successful. Current projects, you can see that here. I don't want to list them all because I don't want to take up too much of our time, but we'll share these slides as well so people can see them later. We also started a weekly listening and sharing session for the K-12 program, and that is still running weekly and planning to run either weekly or bi-weekly in the new year as well. We're working on how to reach out to Native school communities. This is kind of a new demographic for us, since we've mostly been working with behavioral health providers in the past. And so these are some of our strategies to be more connected and to support K-12 programming. And then we'll get finally to our prevention TTC. And also the consultants and partners are very similar to what the previous ones were. We have monthly webinars for the PTTC project. We also have these beautiful culture cards that have been developed. They're these handy cards that people can take with them if they need to keep things on hand to remember things, ways of learning cultural connectedness, of understanding culture as prevention, and then the sacred and ceremonial use of tobacco in Native communities, and also engaging tribal leaders for prevention efforts. We also have a substance abuse prevention skills training for Native Americans, and honoring the circle, honoring children, mending the circle. Sorry, I won't go through all these, so we can keep moving here, but here's some other collaborations that we are currently working as well. So that's all that I have for my part of our presentation today. If anyone has any questions for me, I'll invite you to put them in the chat for now, and then we may have some time for discussion at the end. But I want to give Pam and Shirley and Jessamine some time to present on some of their tools and resources that JBS has developed with us. So I'm going to pass it over to you guys.
Thank you. And am I to pull up the PowerPoint or you pull it up?
If you can pull it up.
So you already passed to share the screen? Okay, can you see it now? And then I'll just go to slideshow.
Yep, looks good.
Okay, so how do I make it view? Normal, maybe. View, how do I make it? Oh, here we go.
So go to slideshow and then start from the beginning.
Slideshow from the beginning.
There you
Wonderful. Go. Okay. Okay, hi everybody. Pam Baston again with JBS International. And what we are doing is going to show you some of the tools and resources that we have created, mostly with your input or with different recommendations that were made over different times, like meetings or care and share. So our team is me, Pam Baston, Shirley Kane, who you met, who's a former tribal judge and an attorney, Joanne Roser, who is not with us today. She's at a medical appointment, but she's got about 20 years in the healthcare industry, actually more like 25. And then Jessa, who's also Jessamine, we call her Jessa Jackson, who's our digital media research assistant. She does all of our beautiful graphics. And so you'll meet two of these staff in just a few minutes. So this is a tool, and we call these QRRs, Quick Reference Resources. We don't really call them toolkits because sometimes toolkits are large, you know, they're almost overwhelming, and we try to make tools or quick reference resources that are quick and easy, that are not complicated, and that you can just pick up and implement with very limited study or preparation. So this, we created a whole series called Set for Success. Anytime you see this blue logo at the top of the, in blue, and that was a logo created by Jessa, that has to do with resources that would be very helpful for grantees, particularly new grantees. So these are resources where we say, do you want to start your implementation strong? Do you want to be prepared for most anything that would arise in your early implementation process? So we have heard through many, many grantees that sometimes selling medication-assisted treatment is a hard sell, that different members of the community and sometimes even tribal leaders will say, oh, when you use medication for opioid use disorder like Suboxone or Subutex, you are just replacing one drug with another. And of course, we know that that's not true on a number of levels, but you know, you sometimes only have a small window of time to be able to educate people about how the street drugs of heroin and in prescription opioids that might be being misused, taken into higher dose or taken from the street, and then also fentanyl are drugs that are very dangerous for a number of reasons, whereas the medications that you would take as part of a regimented treatment program with a medication-assisted treatment provider would not be dangerous in that same way. So I'm going to show you in the next slide just a little slice of this one-page handout. Let me first point out that to the left are the various kinds of variables that we compare and contrast these two situations. The second column is what happens with an illicit drug or a medication used inappropriately. And then the last column to the right is how does that look if it's a pharmacological, you know, medication used as part of medication-assisted treatment. So let's zoom in for a minute so you can see what a piece of this looks like. So let's look in the first column, motivation for use. What is the motivation of individuals if they're using street drugs or they're misusing prescription opioid treatment medication, opioid pain meds? Then they're doing it because they either want to maintain their addiction or they want to get high. They want to avoid any withdrawal or any other adverse consequences. Whereas the motivation to take medication as part of medication-assisted treatment, again, Suboxone, Subutex, naltrexone, one of the medications, is for recovery, to support their recovery. The context of use, one of the other variables we look at is, you know, if you're using illicitly, you're using drugs illegally, you're using it out in a dangerous setting, perhaps. You might be using it out in the community. You're using possibly with others as part of a drug using network. If you're a parent, you may be using in the presence of your children. This is especially an issue during quarantine, so that you're not getting away necessarily. And so the kids are observing this or being exposed to these, you know, dangerous drugs. Whereas if you take medication as part of treatment, you have medical supervision and oversight. What's the purity? You know, who knows when you get a drug on the street? No matter how many of these medications are made to look real, and some of them are even very sophisticated. They have stamping machines now that people can operate in their garages where they just put a big batch of chemicals together, but they can run it through a stamping machine and press perfect pills that look exactly like what you might get from a physician. So, but there could be anything in there, and there often is, and that's why we have so many deaths, is from fentanyl that kind of sneaks in there. Well, of course, you don't have that with medication-assisted treatment. It's all looked at by the Food and Drug Administration. Everything's made in a laboratory setting in sterile conditions. Everything's exactly measured so that everything is equivalent. If you have, I'm making this up, but 16 milligrams of Suboxone and you pull 10 other strips of 16 milligram Suboxone or medications, they will all contain the exact amount. So these are just 3 examples of many in a page-long handout that will be, if it's not already, before we hang up today, we'll ask Kate to verify, but we believe that these are on the website already. And Kate, I do have one update on this form that I'll send you when this is over to make sure we have the most current one. The overdose potential, that was another thing, is extremely high when you take this column called opioid misuse or fentanyl or heroin. But the overdose on medication as part of medication-assisted treatment, I put non-existent or something, and Dr. Thundercloud wanted me to caveat that because it is non-existent if you take the medication as prescribed. But if you took all of your medication and someone else's medication and someone else's, I suppose there's a way you could be at risk for overdose, but when taken as part of a standard medication-assisted treatment program, that is not a risk factor by itself. We'll go to the next one. This was one of my favorite tools to create. This is called Welcoming or Wanting. And this has to do with what does the first impression that a client has when they come to your facility is often the waiting room. And so in this instance, we have a stock photo of a waiting room that's very sparse, kind of ugly, very brown, very, you know, there's no color, there's no vibrancy, there's some trash on the floor, nothing special. All the seats are kind of stuck together. It's not even appropriate for social distancing anymore. Just not a very welcoming place. And then in contrast, here's a photo now, full disclosure. I created this photo in my living room, a basement, where I just pulled together some native art I had and rearranged the furniture in a certain way. And through the help of Jessa, created some special effects in there. But I want to point out some things about a warmer waiting room. So for example, we have a charging station here so that people that are coming in waiting can charge their cell phone or their laptop or their iPad or whatever their device is, especially when folks are homeless. They don't always have access to electrical outlets, let alone various cords and things. And you could buy these things at thrift stores pretty much to fit almost any device, and you know, maybe some of the newer devices you'd have to buy newer versions, but it's just a small convenience for you to put out, but a big convenience for clients. I used to do waiting room visits all over the country, and the best thing I ever saw in a waiting room I incorporated in this, and that is that they had a suggestion box, which is not that unusual. You know, a lot of programs that are really good and that really care about their services have suggestion boxes. But what this program did is they took those suggestions and they implemented those that they could and that were reasonable. And then they had little graphs and charts that they posted in their waiting room on the wall that said, like, we listened, you know, like I'm making this example up, but like, we heard from you that our counselor ratios were too high. We heard, now we've lowered our ratios. And then they would put like a bar graph that showed what it used to be and what it is now and how much satisfaction had improved and just different things like that. So, you know, having reading materials that aren't from 1987, you know, having ones that are really interesting. And these don't have to be expensive. You can get people to donate magazine subscriptions. When I read mine and I'm done after reading it right away, I give it away. You know, I'm not going to go back and look at it again. And you might just rip the address off, but have a collection of magazines and books and things for the children and some toys and some water. If you can't have any, you know, other drinks to offer, maybe at least some fresh water. If you can afford coffee, obviously that's a bonus, especially in the morning. But anything that you can do to basically say, we value you, we welcome you, you matter, to have people interact with these individuals always with a smile, you know, from the receptionist to the custodian to the therapist, everybody. That greets people warmly. And I realize that COVID has changed some things. We can't always shake hands now. We gotta, you know, do the elbow bump but, you know, even if you have a mask on, you can tell when someone's smiling. Their eyes kind of crinkle, you know. We did have one of the states that we worked with did an experiment by sending a young man into a waiting room to test how responsive the staff were. And he sat like this with his head down and his hands for 3 hours, and no one came out to check on him. No one. Staff came and went. People walked in and out for lunch. The receptionist ushered people in back and forth. Nobody went over and said, "Hey, buddy, you okay? Is everything all right? Do you need something?" Nobody checked on him. So all of this kind of guidance is in this resource. We know that you can't always do, things as welcoming as you want. I know one of our grantees is in an old jail, and they literally have metal bars on the wall or in the windows. Maybe you can cover them with drapes. I don't know, but I know you've got some challenges, but there are ways you can make up for those challenges with fresh paint, something that doesn't look institutional, and some vibrant native art, and other things that we've talked about. So this is a sample. We also at JBS work on the mental health project, or we did, and there are some grantees that have the circles of care. Some people know it as System of Care grant, and some of you may have these grants or may be applying for them. I believe they're out right now. And so they know that you have to have partners. Nobody can transform a mental health system for young people by themselves in a vacuum. You have to work with the schools and the police and the judiciary and the, recreation centers and the Boys and Girls Clubs and the health departments and, Parks and Recreation or wherever, all the different groups that would interact with a young person, child welfare, juvenile justice. And so to have those partners on board is really key to get this grant. And even if you don't have the grant, if you want to run a good, effective mental health system for young people and their families, and we don't just say families, we say caregivers, because we know sometimes it's auntie or it's a neighbor or someone else. So what we did is we created all the different systems that you might need to work with and some very concrete, practical examples of the kind of roles that these people would play, so that if you're writing a letter of collaboration to get them on board with you, that you can maybe use some of this text in that letter to say, here's what we would like you to contribute as one of the partners on our team. So this is a very helpful multi-page. All of these documents that I'm showing you are pretty much multiple pages. We're just showing you at a glance what it looks like. Jessa will tell you later about the header. When you see this particular header, which is the logo that she created for native systems of care called Circles of Care, anytime you see that logo or these hands down the side, that lets you know you are in one of those tools that we created. Also, you're welcome to use that header yourself on letterhead. We give you that as a sample if you want to write letters to people. And so anytime they see these colors or that logo, they know that it's part of your project related to mental health circles or systems of care. Now I'm going to pass it on to Shirley, and she'll take it from here, and then we'll come back. Shirley, maybe if you could also do a couple of Joanne's, and then Jessa will take over on her slides, if that's all right.
Okay.
And
I'll do my best with the time I have, because I
Sure.
see we've got about 20 minutes left, and I
Okay.
have another meeting right after this.
Okay.
So we did 6 webinars, averaged about once a month, maybe once, every couple of months. Our first one was with Colin Cash. He was the co-founder of the Sober Squad, and they help with a bunch of different grassroots types activities in the communities. They have recovery walks, recovery meetings, and they transport their people to and from the meetings. They have pizza dinners. They have a Facebook page and a blog. And his famous quote in one of the papers here in Minnesota is, "Never underestimate the power of someone in recovery who wants to give back." So they call it in the old AA terms, the 12 step. So they really believe in that and they follow it. And also they don't stay anonymous. They publish who they are. So they want the world to know who they are and want to help other people. And then he came in and he participated in one of our regional meetings and gave really good feedback during the meeting. And then Ron Kobenes, the name of the workshop was Mino we do Kawishin Anishinaabe Minopimadiziwin, means helping our people to be healthy in a good way. And then Ron Kobanes from Red Lake, he's a spiritual leader. He spoke on MAT and how he didn't exclude people who were on MAT from coming into the ceremonies that he held. And he does sweats for his community. He does a ceremony called the tree ceremony. And he also does namings. I saw one time he named like 10 people at one time, not, like one after the other. And he really believes in incorporating culture and wellness into the prevention, not just prevention, but into the treatment process and after the treatment for follow-up and for aftercare. Lori York, she presented on whiter child welfare, and they had a whiter child welfare initiative where they took over the funding from the states and brought the cases into the tribe. And White Earth and Leech Lake did it in Minnesota, and there's 2 more tribes doing it too. But she had a program, and it was a grant from the state of Minnesota called Gijwaso, and it's a holistic healing system where they had them use therapy and then also cultural processes like cedar ceremony, sweat lodge ceremony, and other ceremonies. And then also had them make different crafts like quill work and regalia, and then also gave them sage and shells to help with the smudging. So it was a very successful program, and it was like about close to 100% success, which is really awesome. Jenny Cole Mossman, she works for JBS International, and she presented on taming tough emotions, especially right now with a lot of the people, like isolating, having to be in quarantine, and how stressful that can be just within the family system. So she talked about, like getting in touch with your own feelings, self-regulating, making yourself calm before you talk with a person, assess their feelings and what they're feeling about the situation, thinking through it, talk through it with them, and then reflecting afterwards on how it went and what did you achieve. Okay, next one. And then the healing toolkit, I designed it with thinking about what was successful in other areas. So this toolkit is designed to help people who meet with their tribal leaders or elders or even community members to talk about what's happening in their community. Okay, next one. And these are just a little bit of the data. There's a little bit more data. This is just a partial one. And the top things were how many natives are homeless. And nationally, natives have the highest rates of homelessness of any group. So it's pretty high compared to the small numbers we have. We're about 2% of the population, and yet we have a higher percentage of people that are homeless. And then the one below it is the suicide rate. It's very high, especially among the youth, but it's getting higher amongst people in other age groups. Okay, go ahead. And then how do we address stigma? A lot of tribes are doing it through social media, billboards, and sometimes they're doing brochures and passing those out, TV and radio, and then some of the tribes are doing like Good Health TV and that kind of thing, and it's really helping, and it's like educating their communities. And then like Pam said, is it replacing one drug for another? And it's, the way to look at it, it's helping. MAT is one of the tools to help our people to heal. And then also, do people allow smudging? And for the most part they do, but follow your spiritual healer and your cultural healer in your community. And the last one down there, it looks at the high cost of the opioid use, $78.5 billion per year. And that doesn't account for, like the out-of-home placement rates, and then the babies being in NICU. Okay, next one. And then these are some of the things that I came up with. It's how do you help heal? How do you help our people heal within our communities? And I'm sure a lot of you have your own programs. And these are just examples of some of the things that I know people do, the tobacco offerings, the medicine gathering, and always put the tobacco down And it doesn't have to be commercial tobacco. It can be traditional tobacco or connect, or if you grow your own tobacco, using talking circles, you know, in groups or in your families, and then sweat lodges. Okay. And this last page is dealing with the recommendations that were made by a lot of the tribal leaders, and it's part of the tribal behavioral health agenda. So it's looking at culture and spirituality and say that not one size fits all. It depends on which tribe is utilizing their spiritual practices, and please defer to the tribes. Re-entry programs, there's a really awesome group, the Yurok tribe is working on designing like a re-entry village for their people coming back from prison and treatment and military. So they have a place to live, and it's like a wellness kind of theme. Collaborate across all systems, and then treat SUD and mental health as a disease, and try to, you know, like help with the stigma around those diseases, because there is a lot of stigma. Okay, next one.
And I just wanted to say that this is the mental health case study for the mental health portfolio, but can be used with TOR also, because a lot of you are working with kids. So you can go ahead and explain that, Shirley.
Okay, this is a case study. It's about a young man, and he's having issues at home, and he's like, has a lot of responsibility because his dad's been gone, and his mom does, you know, takes care of them primarily. She's the primary caretaker. And then she's absent because she's working. And so he has had a lot of responsibility placed on him. And he's a good kid. I think he's just got himself, you know, like in a situation where it's really, really tough. And that's not unheard of in Indian country for the younger kids. And so what do they do? How do they do it? And what kind of tools do they have, or what kind of tools don't they have? And then what kind of parenting have their parents have, or grandparents? And is there anything that he needs or anything his family needs? So what would you do? And these are the questions we asked our participants. What do you do? What's the first thing you do when you look at this? How would you design something, a system? So I would assess the needs. What are the needs? What are his needs of him and his family? What do they need? And then what tool do you use to assess? There's different types of tools you can use. What else, what do you do if you don't have the services there? Do you refer? What kind of referral system do you have? Will he get a case manager? Is there a case manager for the family? Is there any partners in the community you want to look at? Who will you partner with? Who will you collaborate with? And then also, what kind of support does the family have? Do they have, you know, an auntie or an uncle or a cousin that could step in and help? So look at the different support systems that they have, and what kind of natural supports do they have in their communities? And then also, what kind of resources are there? Because not all communities have resources, and what can you do with the resources, sometimes limited, that you have? Am I missing anything, Pam?
No, the only thing I want to mention is, again, this is only one page of a multi-page document. We also have one for pregnant women, and we also have one for just a person in TOR, an adult. So just know that there are multiple case studies. This one in particular was designed that when if you have the mental health grant and you want to pull people together to plan your system, that it gives you like an exercise that you can pull everybody together and do an interactive exercise. And I think what we'll do, since we only have a few more minutes, if it's okay, is we'll have Jessa cover the posters while you're also still there, Shirley, and then we'll backtrack on anything we have time for from Joanne's part. So we'll come back. So Jessa, why don't you walk us through the posters, and then we'll go backwards on some of your icons.
Okay, should we go back a few slides or?
Not yet. We're going to go back. This is well, let's see. No, this is the first slide. So we're going to on posters. So let's start with posters.
Okay. Well, these are a few posters that Claire,
just our team
created to give out to multiple organizations and programs. to put up in different locations where possibly Native youth or whoever's dealing with trouble at home can see it, and they can take it, and you can, where it says add your message, you can put your information and for your organization and your logo to give out to the Native
Just the community.
my community.
Yeah.
So this is one that I created where it has the contact information below and your logo for your organization.
The other thing too, excuse me, Jessa, I think the thing down there, they could put it in their language. What they have on top, they could put it into their language down on the bottom.
Mm-hmm.
Exactly.
Exactly. So you can go to the next slide. I didn't know I was doing these slides.
Sorry. Yeah, no, these were just examples of youth, male, female. We have, I think, 8 different ones, and we have adults.
Mm-hmm. Yep. So, yeah, pretty much whatever I said applies to this poster as well. Yeah, we have different ones that apply to different situations, whatever messaging you see, whatever touches you, you can look at it and hopefully use the information and like it says reach out. So
Yeah, and all of these are whoops, here we go. All of the posters, you can print them right off your computer. You can put them anywhere you want. Like Shirley said, add your native language in, add your contact information. We've got probably 16 different ones, male, female, old, young, and you can customize them. And it should really help with outreach because a lot of people just wait for the clients to come to the front door. Well, by putting these out in the community, folks know who to go to for help. Maybe put them in the laundry rooms and places where kids hang out in the community, and schools, and anywhere you can, just all over the place. So Jessa, go ahead with these.
Okay, so for the example on the right, which is the circles of care, it's for the mental health ATTC, and it is to identify the circles of care resources such as agendas, case studies, correspondence, etc. And then on the left, the graphic on the left, is the header that we put on for the tribal opioid response tools that are designed for new grantees and others wanting to begin a successful TOR implementation.
Mm-hmm.
And yeah, so this is another slide that contains 2 examples of posters that I designed and 2 other graphics that we use in several of our tools.
And I want to mention that on these posters and the other, Shirley was very instrumental in tying some of the messages to Native values of courage and bravery and kindness and love. And so these were part of our destigmatizing effort. And I love this one Jessa did here at the top. And again, she worked with Shirley in the design, but where you see the 2-eyed seeing, the use of Western medicine, which is the right-hand one with the more, Western medicine, and then the left being the Native, cultural medicine wheel. And to show that together, there's a way to blend and integrate these 2 things in medication-assisted treatment. And this is just.
And here are more icons, various icons for various reports and tools.
And so if you guys, I'm going to walk you through one last thing before we hang up, and that is that just on all the part that Jessa did, she's very creative. She follows a number of young people in Indian countries, so she stays up to date with, different sayings and graphics, and she works closely with Shirley when we design things. So if there's anything that you really need to get better engagement with your clients and you don't have the budget to do it yourself and you would like us to help with that, just let us know. We can't do things just for one program, but if you had a good idea, we could make it available to everyone and you would also get it. And then lastly, this was done a little over 6 or 7 months ago. It's a compilation of all the innovations that we saw during some of our regional meetings, or some of the innovations that grantees were agreeing with us to capture. That was artwork also on the front done by Jessa. But this is just a tremendous resource of innovative things that are being done through the TOR grants around the country. And then we use a lot of our notes to inform the work we do. We're doing TA on harm reduction, medication assisted treatment in jails, community wellness. And also, this is an example Joanne created of incentives that you might want to use if you're trying to incentivize folks to come back for GIPRA reporting, your data reporting requirements, or to participate in certain contingency management. And she just wrote down all the things she heard from grantees, native and non-native incentives that might be helpful to get clients more involved. And then lastly, again, during caring and sharing, Joanne writes down all the major topics that come up, and these on the screen here are some of the ones that we are hearing over and over and that we're working on some resources for. So we'll go now to questions. I know we're right on the money, or we might be late. Oh, we got 2 minutes, whoops. So, and I don't know whether there's any questions Kate, in the what do you call the chat box?
Yeah, a couple people were asking about the resources, and so I shared a bunch of links a little bit earlier, and we'll also be sending a follow-up email to everyone who registered. That will include a bunch of these links to resources. We'll also attach a bunch of those to some of those posters. Those have been really popular. They've been people have been really excited about those, so we'll attach those and make those easy to find and share, and the PowerPoints as well. So if you realize you have questions about anything that we talked about today, you can also email me anytime, and we'll respond to those. Somebody asked a little bit earlier.
Templates we didn't even get to, so those were just a sampling. So
a smudge, a smudge kit is the abalone shell. It'll use, sometimes can be a little one with sage in there, and then sometimes matches. That's what I think a smudge kit is.
Yep. Someone asked a while back about training for preparing for the alcohol and drug exam. We do have a regular training for that. We have a couple of different ways that you can do it. We have a monthly webinar series that's based on that, just preparing for that. And we also have an online course you can take, as well as we do regularly offer an online training for that. And so if you are on our listserv, if you're subscribed to our listserv, you'll get those announcements for those webinars and those trainings. But I'll put my email here in the chat as well. You can either ask me more about that, or you can also ask me to subscribe you to the listserv if you are not already on it, and I can get you on there too. I don't think I see any other questions right now. So yeah, I want to thank all of you for joining us and for doing the work that you do. We're so excited to partner with you and to support the work that you're doing, trying to help those who are struggling with addiction or other things. And we want to be a resource for you. So please reach out, and we would love to get to know you more. And I want to thank Pam and Shirley and Jessa and all the work that you've been doing and these wonderful resources. And yeah, we'll look forward to seeing you all soon. And like I said, I'll be sending an email out to everyone. And so there will be lots of resources there, and feel free to hit us back with any questions you have. All right, well, thanks so much, everyone, and I hope you all have a great day.
Bye, everybody.